With every star, we are born again. Open your heart, spend less time in your head.
Okay, all right. What I want to do is I want to show you a little presentation on the 4 positions on the arm and Ayurvedic Thai Yoga or level 2, supine position. And first thing that we're doing is we're going to work the arm in a couple of different positions, and we are generally going to work all of the lines or the primary lines on the arm in a methodical fashion, okay? So the first thing I'm going to do is I'm going to adduct that hand out 90 degrees. If the mat is graded or short, because sometimes we use more narrow mats, then it's okay to get a bolster or some kind of support under the wrist so that when I put pressure here, I don't put adverse pressure on the inside of her elbow. In other words, I don't want to hyperextend the elbow, okay? So step number 1 is going to be open the wind and warm up the lines on the anterior medial arm in this position, okay? So the first thing that I do is I look at her hand. And this is the key to the arm, by the way. You see this fold right here in the hand. Don't move your hand. You see this fold right here on the hand, okay? And if I squeeze, you see the line right there? And so this is where the 1st and the 5th metacarpal come together, and this opening right here is called the carpal tunnel, okay? It's where the radial and ulnar nerve and lymphatic vessels and other kinds of things, all the blood supply and whatnot, enter and exit the hand. But the bony alignment also between the base of the 1st and the 5th metacarpal is super important. Anybody who works with their hands, quite often, okay, you get spasm in the major muscle of the thumb, which closes the gap here a little bit. So then you actually end up with a deficiency in circulation because of the spasm. The more you work with your hands, the more you're likely to have this. Okay, and also if you work hard with your hands in a given day and you do this, like squeeze your hand really tight, everybody do this, squeeze your hand really tight, and now just pop open. Now, if you use your hands a lot, you lift and you squeeze and you use a lot of that, a couple times a day, if you squeeze your hand and pop your fingers open, you'll notice that they don't pop. That when you go like that, it goes kind of slow or kind of dampened, or like it's a rusty hinge or whatever. And what that means is you have ischemia, low oxygen, and excess spasm in the hand, right? So as a person who uses your hand, if you notice that, then you want to correct it. And if you're doing a job that requires you to squeeze or hold heavy things and squeeze, okay, and you notice this, see, this is a subclinical spasm. Okay, spasm might be where I have pain or I can't even open my hand. And if you ever notice this too, you'll go to open your hand fast and it goes, instead of going pow, it goes kirk, kirk, kirk. Almost like the joints stick as you're trying to open your hand, okay? All right, again, that's a symptom of ischemia and spasm, and it is a preclinical or subclinical paresthesia, okay? And if you have any numbness or tingling in your hand at all, okay, that's a sign of impingement on the carpal region of the hand. It may not be carpal tunnel yet, but it's certainly something, okay? It will happen in the outer 3 fingers first. Outer 3 fingers, you'll notice the stickiness first. But then and that's a progression. When you notice it on the inside fingers, it's much worse. Okay? So anyway, it's just, you can do this anytime. You're doing some hard work. Just squeeze your hand really tight, pow, and open it. And this should just pop. Okay? And if it doesn't pop, that means there's something going on with your hand. All right. Now, I assume, because I know what her occupation is, that she has some of this even when she's not working. Because over time it becomes chronic. This impingement becomes chronic. The spasm becomes chronic. The low oxygen becomes chronic. So I'm just going to assume that these carpal bones are not in their proper orientation unless I check them first. I'm also going to assume the same for elbow. I'm going to assume the same for the shoulder. So technically, we call it open the wind, which is a enhancement of prana through the wind gates. However, if I do my open the wind correctly, if there's any structure that is out of alignment, it'll self-correct right then also. And you may feel it, you may not. You may hear it, you may not. Because remember, you don't have to hear a correction for there to be a correction. Okay, because that's whole nother thing. It has to do with exchange of air pressure in the interjoint synovial fluid, right? And then amplified through a hollow bone. And that's why things pop or crack or whatever when you're working on them, okay? So that doesn't mean anything necessarily, right? Unless you break it. If you break it and it goes, then that's probably not good. All right, so she has that line, right? I have that line, right? I put the base of my hand, I make a perfect cross with the base of her hand. Why? We call that a saddle joint, or it could be, well, it's actually called a saddle joint, or it's called a horseshoe joint, okay? That's describing the relationship between my carpal bones and her carpal bones, right? If these are out of alignment on her, the second I go to put pressure, they reduce, like they just did.
I heard a snap or a little pop.
Okay? They were way out of alignment, okay? And now they're not, okay? So that's emphasis on the hand, first position. Emphasis on the shoulder, okay? Straight down from the sky, round palm on the round shoulder. So I'm really got the perfect ball of the humerus there in the palm of my hand, under the anterior deltoid, okay? But let's just call it front, and also that is the lung, believe it or not. So when I put my hand here, okay, I'm not putting my hand on her lung organ, but I'm putting my hand, I'm covering all the primary origination points for the lung meridian, lung 1, lung 2, and the starting points for the lung TSM, or transsubcutaneous neuromuscular channel. Okay, that's another concept. All right, so you have two lung energy lines, and then you have Tyson lines. All right, so I already did this, but actually I would always do this together. I'm just breaking these out so you can see the secret. You know, in other words, the secret thing I just did here, that if I didn't tell you I was doing it, you'd never guess. You'd never know, and you'd never guess. Why? There's nothing to see. There's nothing to see. Okay? Same thing here. So I'm at one end of an energy line. I'm at the other end of actually 3 energy lines. Okay? So I have my cross here, and I have my palm here. Now, you guys can come in a little closer because the light's good enough, I think. When I put pressure, static pressure, on these 2 points before I palm press, you're going to see a change here. And she's fair. You may be able to see it. Okay? So don't look at my hands when I do this. I want you just to soft gaze. I want you to look at this line right here. You with me? All right? And also, make a note. I told you this was going to happen before I did anything. Okay? You ready? Watch. Keep watching.
Oh, she's red.
Keep watching. You see the line?
Wow.
White line, yeah.
Okay? So, a lot of times, you should ask yourself sometimes, how do they know there's an energy line there? How do they know? Is it a nerve? No, it's not. Okay? And part of how they know is because they pay attention. They pay attention. See, like when I'm working on here, I'm not looking off into space like this. I have a soft focus which means my eyes are gently diverted downward, but I'm not staring at what I'm working at, but I'm not seeing it at the same time. You know, it's like we used to say in shamatha meditation that you have several eye positions. Your eyes can be wide open, your eyes can be closed, or your eyes can be half open. Okay? And my teacher said it's the third one. That if your eyes are wide open, your mind is full of distraction and often misdirection. Oh, shiny. Boobs. Food. Because my eyes are wide open. Whatever's in the periphery of my vision, I will react to. But if my eyes are closed, I will take a nap. I'll go right to sleep. I'll go right to sleep. So when the eyes are halfway down, soft focus, I'm neither too attentive, too external, nor am I so internalized that I miss what's in front of me. So sometimes you can see more with a soft focus than you can see with a laser-like eagle eye. Okay? Now so far, now that already told me what I'm going to work. The other thing that happens is, and this did not happen with her, okay, is when I first rock up, because I want the pressure to be straight from heaven into the earth, when I first rock up and then I sink, that's how I create pressure. See, I rock up and sink, okay? Now, if there was a misalignment in the shoulder here, in the alignment of her arm and shoulder blade and collarbone, this would do the same thing this did. Right there. Now, this is not chiropractic, especially not chiropractic right now. Why? Because it's just incidental to the pressure. I did not tell the hand to adjust. I did not tell the shoulder to adjust. Literally, me being here is just asking a question, hey, how's it hanging? And simply because I bring energy, attention, consciousness, breath, and pressure to the line, adjustments occur. So we call it spontaneous correction. But it's not spontaneous correction without some incentive. And the incentive for the correction is me bringing energy, attention, consciousness, breath, and pressure to the marma. This is a marma, 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 this is a marma. Okay? So as I bring my attention to it, and the other thing was, watch again. And it's just the starting point, man. This is not even working the 4 positions. This is the first part of position 1. Cross, cross. Now just watch here. You ready?
Yep,
You ready?
I guess.
Okay.
Probably not.
Do you see it? Did you see that?
Yeah.
Watch again.
I saw it. That
It's
little
pretty dramatic if you
skinny
don't
line
watch.
right there?
No, just watch right here. I'm just going to compress straight down, but watch right here. Okay, here we go. 1, 2, 3. Up and see it open? Mm-hmm. Okay, so if there was any misalignment or impingement or maladaptive adjustment in the elbow, right there it would self-correct. Because I do the tension, and when I release, it wants to go where it's supposed to go. But when it comes out, when I do that lengthening there, that's called traction and decompression with static compression. Traction and decompression with static compression. I pull the ends of the bones apart very specifically, and then they will jostle to go to where they know they're supposed to be. The innate is always functioning no matter how messed up you are. Half of what it means to correct things structurally is just give the body a chance. Just put it in a right environment. It will self-correct 99% of the time. Okay? And I haven't even worked the line yet. And I've already done 3 joints, traction and decompression. So we say energy has to come from somewhere. Energy has to go somewhere. So we always work above and below what we want to have more circulation. So here I go. So now I'm up, and now I'm just going to rock on and rock off. Or like my friend John Chunkel in Chiang Mai would always say, walk and wool. Skip the elbow.
Who said that?
John Chunkel. Actually, now it's Grandmaster Ajahn Chankol. I helped him open his first school in 1990. Walk and wall. See how I rock on and rock off? And when I am up, there's direct pressure. When I'm back, that's when I move. Don't lift the hand. Just slide to the next spot and stay off of the elbow. Stay off of it right here. Okay, so first part of line number 1 is straight on top and down. Okay, line number 1. All right. Then what I'm going to do is I'm going to work the same line now with thumb pressure. Start in the axilla, in the pit. Yeah, in the pit. Okay, I know a lot of people are pit averse. Pit averse.
I'm pitta averse. but not-
So let me see if I got you. Let me see if I read you right, Dr. J. You're saying that I need to put my thumb in somebody's pits. And I'm like, kind of what I'm saying. Okay, why? Because at the apex of the most interior part, the most medial part, where the arm meets the body, there is an energy point. There is a sublome right there that actually controls the heart. Actually controls the heart. If you're having severe heart stress, if you are anxious, if you are AFib, if you are in really strong heart stress, okay, I can move your arm into a V so I can find the apex easy. See, it's harder to find when the arm's up here, believe it or not. It's actually easier if I bring it down just a little bit, and then I go right here and I go right up in as far as I can possibly go. And now I hold that for 5 count. I should feel a pulse, and that's the brachial pulse. 1, 2, 3, 4, 5. And if we were doing Jobsen Nuat, emphasis right there, I would go, buck, as I leave. And I leave her with a little something, something. Okay? But in this level, for the level 2, I'm going to start with that point and gently push in, roll up. Come down the length of my thumb. Gently push in and roll up. Gently push in and roll up. Gently push in and roll up. If I'm on the most sensitive part of the brachial plexus here, I'm exactly in the right place.
It's tender.
How you know you're in the right place is it's uncomfortable. So there is no adjustment to be more comfortable here, because if I move my thumb up or down to be more comfortable here, I'm in the wrong place. And also, here's another one. The sin is the tightest line in that section. The tightest line. And by the way, the tightest lines are always the ones that are most tender. Always, 100%. So to make the client tolerable, I just go just before she starts to wrinkle her nose. See, watch. Here is superficial. Here is...
It's not tender right there.
No, but your nose is turning white.
It is?
Yeah.
Oh,
So...
that's tender.
So just before that is deep enough. Just before I get a little crinkle or I start to see a little white band here, you know, different people will express it. But if I see a change in color around the nose, I'm right there. I'm at the bottom. So I'll back off just a little bit. Back off. All right. So notice where my thumb is. Can you see my thumb as I'm thumb pressing? Pretty much. If you were me, could you see my thumb? Because I can't. Why? It's under my hand. So the proper place for my thumb is out of sight. Because if you can see your thumb, you're about to hurt it. All right? So down, up, down. All right? Position 1. All right? Position 2. I turn in 45 degrees, bring the arm down, and point at my navel. Okay, and it's clearly between my legs, right? So far, so good? All right. First, I'll draw the line. So, from the center of the cap of the deltoid, center of the lateral deltoid here, dead center at the top, okay? Draw a line to the center of the elbow. Boop. And then from the center of the elbow, draw a line to the center of the wrist. Okay, you with me? Starts on the side, ends on the top. That's the line, okay? Now, because the top point is on the side, I have to hook my fingers like a fish hook. That's why we call it hooking thumb, like a fish hook. And if I hook it strong enough, I shouldn't be able to see it. If I can see my thumb, I'm not hooking. Okay?
So is it on the deltoid?
It's dead center in the middle of the top of the deltoid.
Oh, okay.
Okay? So, somebody tell me what... All right, everybody find the top center of your shoulder. Relax your arm. Push in with a couple of fingers until you find a knot
Yeah.
Center.
that you can go like across it. Bump, bump, bump. You feel that? All right, what is that?
Tendons? Tendons? No?
Is that the
Are you asking or
epicondyle?
telling me?
Is that
Tell
the-
me, what is that?
Tendons.
Epicondyle, something. Isn't that
Oh
bone
my
prominence?
God. I'm so happy you're here.
Bone, it's some
Muscle?
protuberance.
Okay, it is not a bone. Okay? Technically, it's not a tendon.
It's a ligament.
Okay? But it is the
Fascia.
attachment for. All right, so it has a name. So let's go. Let's take it to the next level.
Biceps.
It has a name. What is it called? That bump, that point, has a name.
I should know this. I thought it was epicondyle something.
You want to bet?
No.
Come on, bet me. Baby needs a new pair of shoes. I don't even have a baby.
Gambling.
Okay, SIT, sit. Sit, Ubu, sit. Stephen Channel,
Superior,
Miami Vice.
inferior.
Sit, Ubu, sit. That was always the last scene in every episode of Miami Vice was a picture of his dog
Oh, yeah.
and him going, sit, Ubu, sit. Sit. So I remember it. Sit. All right, sit means, anybody? Open floor?
Is it like superior, inferior or something? Okay, I'm not. I'm sorry. I should know this. This is sad that I don't know this.
All right, S is for supraspinatus. I is for infraspinatus. T is for teres
Major or minor?
minor.
Okay. 'Cause
Teres
they go
minor.
across. They go across like this.
They-
right? Sorry. I need a refresher in my own modality.
See if I got a sock.
Just we gotta get on the cheaper.
I have a cure for this. All right. No, it's good that you're trying. I really appreciate you trying. It's very good. Supraspinatus, infraspinatus, teres minor, shoulder. That is what controls the motion of the shoulder on the outside, rhomboids on the inside. Those on the top and broad middle, okay? And under here, okay? So it's what brings your arm, brings the shoulder blade forward and in. What adducts. So if you get rotator cuff injury, almost always it's implicated with inflammation and or atrophy or damage in the sit, which is that knot. And if you have someone who has rotator cuff injury, work the heck out of that knot because energy travels the whole length of the shoulder girdle deeply, deeper than you can put direct pressure. Why? Because it's a control point. You always work the whole arm. And that's where most physical therapists fall flat on their face and why you can get therapy and not get a lot of result. Why? Because they're treating the shoulder girdle as if it is the all and all, beginning and end of the whole issue. But we come from a different place. We work what's called distal and proximal. Distal means find an energy line or function that is as far away from the affected region as you can get and still be on the person's body and bang on it. Work it to death. And then proximal means get as close to the injury and work it to death as hard as you can, above and below, without making it worse. And then do both at the same time.
So you're talking like foot or like
Hand.
hand. So same
Elbow,
line.
hand. See, I want to draw the energy through that point. since this is where the energy line surfaces at this well, think of the loam as like a well, a spring. Oh, I found a spring. You know how when you're walking through the woods and maybe you're in a trail you've never been before, and you turn a corner and you find a spring? Have you ever done that? I've done that. What happens to you when that happens?
Joy.
Oh, happy.
Oh, you get happy for a minute, right? You're like, I found a spring. A spring. And you tell all your friends. They're standing right next to you. You're like, there's a spring. Look at the spring. And they're like, yeah, I'm right next to you, dude. Yeah, it's a spring. Okay? This is a spring. It's a well. It's a bubbling place where the prana comes to the surface of the arm and then flows down to the hand before it what? Returns. So it's not just a place where it's interesting, it's like a Florida blue hole type of spring. It's not just a place where the water comes up, it's also a place where the rain goes to collect. It also collects the flow, right? So what we do is work above and below it. All the lines, all the joints that we can get a hold of above and below it. This is how we do it. This is more than just for hand and arm, by the way. Again, if you've ever had rotator cuff, and I hope that at least somebody else here other than me has had that, okay, it affects far more than your shoulder. It affects your attitude. Even your attitude in life. You're pissy. People with rotator cuff are pissy. They're sensitive. That's emotional. That's not purely about an injury or a tendon injury or an inflammation in a joint. It's not just that. It's because it's at the nexus of heart and lung and small intestine. And you can, on your own dime, look up what is heart meridian, what is, right? Heart, pericardium, small intestine, lung, what are those about? And then look up, when you do that, what emotions are associated with those energy lines. And how might a person be overly sensitive who has an injury there? Okay, so you can treat it also emotionally. So the other part of the missing treatment for most physical therapists on rotator cuff injuries or tennis elbow or carpal tunnel is because they do not treat the emotional attribute of the restriction and flow through the joint. And there is one. There's always one. Really sharp chiropractors know this and they'll get on to it. Okay? But most people don't. All right, here we go. So hooking thumb on the top. Emily, you're such a good model. Thank you so much.
You're welcome.
So on the top,
I'm
I'm
enjoying
going to
myself.
hook because I want to get behind that bump. And when I roll my hand, I want to come across it. A little strum. See how it plucks? Pluck. Feel that? Pluck. Does it make you happy when I do that? Pluck.
It's not making me unhappy.
Okay, and now we're going to go down 5 points. One, and as soon as I get past the first one, I'm going to get my hand all up in her business. Okay, but still with the hooking thumb. So I'm not going to try to keep my fingers out. Okay, I'm going to get right up in here. All right, so I'm going to work. I already know where I'm going. So 2, 3, 4, and 5, right in the joint. Now, here I push straight in. No more hook. Right? And as soon as I hit that elbow, what do? Whop, whop. Boom. Change hands. The first point on the second hand is the last point on the previous. So I start right where I left off. Why? I want the continuity here. And I'm going to push in and work. 1, 2, 3, 4. You see how you see my finger long after I'm gone? 4, 5. You see that? See that little come and go? Okay? That's how you know I'm using sufficient pressure. I don't want her to jump and flinch like a fish every time I push, but I want enough pressure that certainly on someone who's as fair as this, I should be able to see my thumbprint for a whole second after I move on. Okay? And so now I go down, up, down. All right? That's position 3. Position 4, I'm going to keep the angle and turn the palm down. And the length of my thumb from joint to end behind this point. Now you can see I've worked it so much you can actually see a little red point there. Okay? So if the pillow's in the way, I'll move it. By the way, anytime the pillow's in the way, just move it. Anytime anything's in the way, just move it. Don't work around it. Okay? I'm going to put the base of my thumb on that point. And then I'm going to hook in to the back of the deltoid now. And there is a pocket right here between the medial and the posterior deltoid. In the supine position, they lay open, and there's actually a clear separation between the heads of the deltoids there. On this line, going straight back, if I'm in the right place, which is, now when I say the length of my thumb, I actually mean the length of her thumb, not mine. Okay? Uniform proportion and symmetry is relative to the client's body always. So thumb length, thumb width, hand width, foot width, elbow length, knee width. Do you understand? Is always relative to the client's body, not to yours. So if you're taller than the client, which I am, then my hands are longer. My fingers are longer. So when I say length of the thumb, I actually have to shorten it up. So I'm going to go a thumb length posterior here directly, but it's the length of her thumb, not the length of my thumb. But then again, I also know what to look for, that there is actually a pocket right there, a hollow spot. And that is also a loam, an energy point. Okay? Now, I have palms down. And if I draw a line from that pocket, from that point, to dead center on top of the forearm here. Now actually, it's a little bit below the joint. So you see how the muscle head is pooched up here on top? Yes? No?
Yes.
Okay? So at the fat point, just above the tendon, okay, that's the middle of the elbow joint with the palm down. And if I push here, it's the most sensitive point, right? Should be sensitive. Now, so I start here. Now I'm going to hook until basically the line comes on top. And then once the line's on top, I'm going to push. But this time, I'm not going to change hands. I'm going always rotating toward the body on line 4. All the way down, and when I get to the wrist, the opposite side of this is where I'm going to finish. So it's in the wrist joint, between the radial and the ulnar, between the two lower arm bones. Dead center where they join the wrist bones. Okay, and that's the last point where I'm going to compress. Again, another angle here. If there's any adverse compression, adverse misalignment, because how many bones are here? Anyone want to venture a guess? Well, there are 3 major ones that are not carpal bones. It's the wrist bones. Okay, the wrist bone. Can they get out of alignment? Yo, you bet. Yes, they can. How do you get them out of alignment? Usually it's with an impact, a fall on the base, like this, okay? And even though you'll have the abrasion, you may have pain on the bottom of your hand, the bones on the top of your hand are now misaligned. Because all you have to do to prove it is try and bend your hand back the other way after you hit. And it doesn't go. It's like, I don't think so. I don't think so. Another time, perhaps. So, this one, no changing hands. In to here. In, down and in. So, on this one, we're rolling away from the center line. In other words, the roll is away from the body. On the second position, here, and actually we count this 1 and 2 are in the same. This is 1 and 2, because this is 1, and this is 2 in the same position. This is 3, sorry, palm up, and it's in on the top, out on the bottom, and position 4 is always in all the way down. Okay, you can stop.
Every star